Hi, hello everyone. I'm going to be doing a presentation on the role of a midwife. On the following slide, I'm just going to say what the role of a midwife is. So, a midwife is a qualified professional that provides support, advice, and care to a mother and her families during the postnatal periods, antenatal periods, throughout labour. As you can see on the board, we've got some statistics up here. NHS is short of the equivalent of 3,500 full-time midwives. In 2018, it was recorded that there are 42 midwives in the UK, and statistics of childbirth, 679,106 live births in England and Wales were recorded in 2017. So moving on, just going to be speaking about some key responsibilities of a midwife. They provide care in the antenatal, labour and postnatal periods. They identify high-risk pregnancies, which can be multiple births, monitor women and support them during labour, teach them new and expectant mothers how to feed, care for their babies. Sometimes they do this before you're able to take your baby home, or in children's centres. Some more key responsibilities. They work with people from very diverse backgrounds. This can be women that may be homeless or have different religions, ethnicities and stuff. They provide support and advice when complications occur, so gestational diabetes, they might need more support, etc. Develop good professional relationships with their mothers and families. This is really important within the role of midwife because you've got to make sure that there's that relationship, that they feel comfortable and everything goes smoothly. Provide full antenatal care, including parental classes, clinical examinations and screenings. So, a brief history of midwifery. Midwifery has played a significant role throughout history. Traced back to the Anglo-Saxon times and the Middle Ages. Within the Middle Ages, women were dominant, so it wasn't male in the picture at all. They were in women's homes. There was no education or training. It was just purely women helping women deliver babies. And in the 17th century, this is when men were more involved and they started to try and argue that they were more advanced and qualified to do the procedure of birth and labour because they invented the forceps, which helped deliver birth. Moving on to the 18th century, this is when female midwifery training developed and improved, so they became more popular again. Midwives, women rose to be more popular again. And then in the 19th century, this again was when the Midwives Act in 1902 came into factor, which made training even more advanced for women, making sure that they had their up-to-date standards of training and education. So yeah, and then compared to nowadays, I think overall that has changed dramatically in for education, training, and just like clinical things that we have nowadays that they didn't have back in the day. Moving on. So who do midwives work with? Midwives work with a range of different professionals to ensure that the best quality of care is given. Just a few main people that I've chose are a neonatal nurse. So a neonatal nurse is someone that works in high intensity units, dependency units, working with newborn babies that are premature or sick, that need more specialist care. An anaesthetist is someone that administers drugs during C-sections, throughout labour. An obstetrician and a gynaecologist. So a gynaecologist is someone who works, a doctor who specialises in the reproductive organs, and an obstetrician is someone that's specialised doctor in the mother and the baby, making sure that everything's going okay. Paediatrician, specialise with babies and children. They may also be a part of birth and help making sure that everything's all right with the baby. And a sonographer, when you first get to see your baby on the screen, and you get to see, they can show daily scans, everything's going okay, measurements, etc. And then just lastly, we've got health visitors who go in, work in the community, helping mothers, giving support, advice, feeding techniques, etc. And it is important to know that midwives work in a range of different settings, not just hospitals. They work in many different settings. So the following slide, referring patients. In midwifery there are many different situations where midwives have to refer patients to other agencies. I've chose 3. High-risk pregnancies is one, so obviously twins or multiple births. There can be many difficulties and problems, such as because the baby share the same placenta, so there needs to be more monitoring. Vulnerable women, postpartum depression is something that women can get after birth, which is a mood disorder, which can cause extreme sadness, anger, anxiety. They may have struggle not getting emotional attachment to their baby, may think of thoughts of harm towards their baby or themselves, which can be very dangerous. So in both of them, they have to obviously be referred to, they can be referred to mental health services and making sure everything's okay. They can be prescribed prescription antidepressants. Domestic violence and abuse, so women that, it's really important as a midwife to ensure that you recognise the signs of domestic abuse or violence, and if you do, then you need to refer them to specialists such as social services that can protect the baby and arrange emergency housings, etc. Professional boundaries. What are professional boundaries? Limits which protect the space in between professional's power and client's vulnerability. So as you can see on the image here, in the middle is where a professional should remain their boundaries, not being under-involved and neglecting your patients, and not being over-involved and being unprofessional. So on the next slide, I've just got a couple of examples. So in scenario 1, a good friend of yours is having a baby and has asked you to be their midwife. Please put your hand up if you would say yes. Put your hand up if you would say no. Yes, I agree. I think that definitely to remain your professional boundaries, you need to make sure that you just say, I'm really flattered that you want me to be your midwife, but however, it would be wrong. I'm not professional at all. There can be problems that can occur. Friendships may be awkward, or they might feel embarrassed to tell you certain things because you're a friend, such as abuse that they might be experiencing. Scenario 2, you see a rather unusual case of deformity, you take a photo, send it on to a specialist that you know who may be able to provide further information on treatment. Take the photo via your personal phone and send it to him by email. Is this acceptable? No? Yeah. It's definitely not acceptable. The main reason is, who do you know it's going to? It could be sent to the wrong person, it could go public. Which is obviously really, really, really bad, and so to make sure that this doesn't happen, just don't send it to take pictures of your clients or anything like that, and if sometimes you can, but you have to get recommendation, and you have to be told by your superior that you're allowed to do it in a safe and legal way. Moving on, policies. Policies quickly are just proposed guidelines and standards that you must uphold. The code is one example which can be used within midwifery. What is the purpose of the code? The purpose of the code is creating professional standards and behaviour midwives and nurses must uphold in the UK to be known, to be professionally trained, etc. Structured around 4 themes, which are PPP, so you've got prioritising people, practice effectively, preserving safety, and promoting professionalism and trust. And these are really important to ensure. So the code influences the role of the midwife to ensure that guidelines and standards are put in place to make sure that you are giving out the right care to your patients. Legislation. The Midwives Act in 1902 is one of the main legislation within midwifery. It's basically law, so it is law, has to be done. Midwifery became legally recognised in Britain in 1902 when it came out, and the Midwives Act provides registration of midwives, intention of securing better training and regulation, because in the 1900s their birth rates were really low and it was very dangerous to give birth, so I think they brought this into action to make sure that this was better and the training was regulated and higher, so that the birth rates wouldn't be so low. So what did it provide? Also the Central Midwives Board was created within the Act. They maintained and published a register of qualified midwives, so you knew who was registered and who wasn't, and it just ensured that women couldn't just be like, oh, I'm a midwife. They had to be registered under the Act to be qualified and trained to do the job and say that they were a midwife. So student bursary, as we all know, student bursary has been cut in 1st of August 2017, so there's no longer a student bursary. It was an annual payment which we would receive as students to going into a health-related course, which would fund for our living costs, loan, our course, etc. And my main question is the cut affecting the midwives nowadays? And in 2018, UCAS figures showed that a 33% drop in nursing applicants since the bursary was abolished, and a national shortage of 3,500 midwives now. So I think it's a main causing factor of why we have such a low drop, and the staff shortages are impacting quality of care, putting patients at risk. This is just the 2018 January deadline of nursing applicants. So here 2017 was when it was abolished, and then down you can see the drop from 2018, just to show, put into figures. So ethics. Informed consent. What is informed consent? Informed consent is when process in which you are gaining permission from a patient to proceed with a procedure or gaining information. Religion, beliefs and culture can come into effect, because certain religions may not be able to do certain things, procedures, etc. Communication is a key aspect of ethics and informed consent. You need to make sure that you don't use technical terms, you're simple, you're clear, they understand what you're saying. Examples, pregnant mother who doesn't speak English, you would have to get an approved translator in to come and check, give their consent and make sure that they understood. And young individuals under 18 they can have consent from their parents, so their parent can give the consent of what procedure they should have. However, the child can still give their wishes, and respect will be taken from that. So my questionnaire results, I did a questionnaire finding out the image of the midwife, and overall it was really, really positive. I got some really nice feedback on describing midwife in one word. Amazing was the most common word that was used. Caring, wonderful, incredible, angels, important, supportive. And what level of education do you think a midwife would need to be classed as a qualified midwife? Picture went a bit funny, but overall there was a 74% said that they should have a degree. So obviously they think that you should have a high level standard of qualification, which is really good. And what gender preference is your midwife? Most people said either, that they didn't prefer male or female, but a lot said just female. And on the next slide I've got an article which I think is why I got the results I did. So this article I got from BBC News. It's about a male student midwife called Dylan, and it was just his article expressing his journey and his experience of being a male midwife and what it's like and reactions he's got from being a male midwife from women and their families. Overall, he says it has been positive. Only 7 out of like hundreds of patients he's cared for have just said, no, I don't want your care. So he thinks that is pretty good. But he understands that a lot of people still nowadays saying they don't feel comfortable with a male midwife, which is understandable. But most obstetricians and doctors, etc., are male, so it makes you question, well, if there's a male midwife, why does it matter if you're getting cared for by a male doctor? So it's just not really that much different. So overall, I just think the reason why the results I got is because there's not enough male midwives in the profession at the moment, and it's taking a long time. But as you can see on here, the NMC 2018 statistics, which is the Nursing Midwifery Council, there's 35,720 midwives female and only 108 male. So this shows the drastic change of the gender. And yeah, so I think overall it shows a positive look on midwives, but there's just not enough male midwives for people to say, I just want a male midwife, etc.